So we're going to present this case. It's going to be a very quick one, but just to highlight and reemphasize germline predisposition, and if this move. Okay, so this is a 14-year-old male who presented to a pediatric hematology clinic with fatigue. So you can see the CBC, the white count initially was 2.3, had a neutrophil count, 800 cells, hemoglobin was 8. Importantly, the MCV for the teenager, it was 105, and the platelet count was 23,000. You know, with the data in mind, so a suspicion for a bone marrow failure was suspected. A bone marrow was performed. It was 5% cellular. There was significant dysplasia in the megakaryocytic, erythroid, and myeloid lineage. As you can see, the erythroid cells, they have multinucleation. The white cells, especially the granulocytes, they were hypogranulated, and there was evidence of monolobated megakaryocyte. Interestingly, the AST and ALT was elevated 138 and 178 respectively. So, bone marrow failure.
Okay, so the mutation we found in this patient, actually 2 mutations. One in the TERT gene, and it is a germline mutation, and the second in BLM genes. But there are no additional mutations, there are no additional abnormalities. And again, you know, the patient is young patient. You know. So both mutations actually detected at in all the cells, and this is why they are germline. You know. In this case, practically, you really don't need to test skin biopsy because there isn't other additional abnormalities. So this is clearly a germline abnormalities and goes with the clinical presentation. So we all know that TERT is a telomerase enzyme, that it is very relevant and important for the telomerase functions and synthesis. The BLM gene, which stands actually BLM for Bloom syndrome, this is where it is originally reported when it is homozygous. But when it is heterozygous, it is a gene that actually leads to predisposition to cancer, as well as to bone marrow failure and aplastic anemias, as a matter of fact. And as you can really see, this gene is involved in DNA repair. And this is actually a list of the various genes. There is almost 150 different genes that can be involved in bone marrow failure. But these are the classes of these genes, as you can really see here. The genes are involved in ribosomal DNA damage repair, hematopoiesis, telomere maintenance, glycolysis and glycogenesis, actin cytoskeleton, and molecular transport and other, you know, and there are multiple very well-known syndromes that are, you know, described as you can read them here. And all these will lead to MDS eventually and AML in addition to bone marrow failure. But at the same time, patient will have additional abnormalities in solid tumors and higher incidence of various types of cancers. And I want to stop here. This is very quick.
Yeah, so at the very end, you know, he was diagnosed with dyskeratosis congenita, and the patient have an attenuated, you know, customized conditioning followed by haplotransplantation. Doing fine.